Hello and good morning. Welcome to our Ontario Network of CAPC CPNP projects online conference. My name is Sydney Bell. I'm the network program lead. And I'm really delighted to be here this morning with a bunch of folks from across Ontario and Canada to learn and share together. And we are here at our first session of the day and of the conference. And I'm really happy to introduce Alison, Mildon, and Joanna Baxter, who are here from the University of Toronto to tell us what they've learned in a recent research study focusing on CPNP and prenatal. So welcome, Alison and Joanna. Over to you.
Great. Thank you so much for that introduction, Sydney, and for inviting us to present on our findings on the research that we've done. I'm just going to share our slideshow. This will take 1 second. Let's see. May I confirm that you can see it on your screen as well?
Yes, I see it. You look good to go.
Great, thank you so much. So I'm gonna hide everybody just so that we can see our screen. If you do have questions, feel free to pop them in the chat. As Sydney mentioned at the beginning, she will keep an eye on that. Any clarification questions, we're happy to get into that as we go. Otherwise, we're about 45 minutes or so. So we do have some time for questions at the end, or if anybody has any thoughts, we'd be very happy to hear this. But yes, thank you so much for the opportunity to share our research. We thought we'd take a second to introduce ourselves if my slides decide to advance. There we go. So my name is Joanna Baxter. We are both postdoctoral fellows at the University of Toronto. My background is in global health and nutrition. I have a keen interest on females of reproductive age, both preconception, during pregnancy, and during postpartum, and how their health relates to their infants. I've done some work with a team in Pakistan. It's about a 10-year collaboration now where we look at multivitamin supplementation, how this affects maternal well-being, and also children's well-being, and some other work with NGOs on surveys. And that is sort of how I came to this project. And it's been a pleasure now to have been a part of the group for about 4 years.
And I'm Alison Mildon. I'm a registered dietitian, and I've also have a background in global health and nutrition, but on the programming side in my case. So I worked with a large NGO, non-government organization on supporting nutrition, public health, and food security projects in a number of countries before switching into research, which I thought was going to be just a master's and then turned into also a PhD where I had the amazing experience of working with CPNP here in Toronto, looking at how we could strengthen lactation support through the CPNP. So that was part of an academic community partnership between the University of Toronto, led by Dr. Debbie O'Connor and Dr. Dan Sellon, with Parkdale Queen West Community Health Centre, which implements 2 CPNP sites. And it's lovely to see Stacia and Jessica and Claudia, I think, in the meeting today from Parkdale, and others that we've been able to meet through our research. So this work started about 8 or 9 years ago with myself and our colleague, Dr. Jane Francis, who's now at Acadia University. And we both did our PhDs in this research program, working with CPNP sites here in Toronto, looking at experiences with an existing infant feeding program that Parkdale Queen West Community Health Centre has, and looking at how that could be transferred to other sites. The pandemic got in the way of some of that work, but we did learn a lot about infant feeding and about how that really takes place in a larger context of people's lives. And we look particularly at household food insecurity, and that has led us into the work that we're doing currently. If you're interested to learn more about those original studies, that QR code on your screen will take you to the short graphic report that we have on that work. And I'm also happy to answer any questions about it. So where this led us to, in our current research program, which Joanna is part of as well now, which is wonderful. We have 3 main areas that we're focused on currently. And the first is what we're going to be talking about today, which is understanding how the CPNP in different contexts delivers supports for breastfeeding and food needs. So we realized that we were working with specific sites in Toronto. That was excellent, but we knew that it wasn't necessarily representative of what's happening everywhere. And so that led to an interest in conducting the national survey that we're going to be talking about today. And we were also able to obtain some additional funding for a qualitative study, so that then the survey gave us the numbers and the qualitative study gave us more of the depth of understanding of what it's like delivering breastfeeding and food supports through the CPNP. So with the funding we had to limit that to Ontario, but you're going to hear some of the findings from the focus groups that we conducted in that study. And it's lovely to see some faces and names on the screen of people that we met through that project. So you'll hear more about that as well as we go along. A second area that we're looking at is looking at formula supplementation in the hospital. This is something that we've heard a lot about, a sense that clients of the CPNP are more likely to get hospital formula supplementation of their babies when they don't necessarily want it and they're trying to breastfeed. And so we wanted to look into that to see whether there's evidence to support that sense that many people have, that there's some biases and inequities going on there. So we've been working with BORN, which is a provincial data registry in Ontario that has the health records of all births in Ontario hospitals. And we've worked with one of their epidemiologists on an analysis looking at whether there's a difference in formula supplementation of breastfed newborns based on characteristics of their mothers. And we're going to have results coming out from that very soon. And then our third project, which is a new one, we're back working closely in the community with Parkdale Queen West Community Health Center, which is wonderful. And again, as I mentioned, our earlier work showed us that if we're interest is particularly in infant feeding and breastfeeding support, we do have to look at the larger context of families' lives. And so we're starting a qualitative study where we're looking at experiences of perinatal care and the role of community providers and how families that face greater stresses and more marginalization experience that whole perinatal process, and how the community is engaged in trying to fill some of the gaps that are there. So that's a new one that's just starting. So it'll be a while before we have findings to share from that, but we wanted to give you the bigger picture of our work. And the reason why we think this is all important and why we want to concentrate our research efforts here is because we have a lot of concerns about child well-being in Canada. As UNICEF, the United Nations Children's Fund, puts out a report card regularly looking at how Canada performs compared to other industrialized countries, and they do the same for those countries. And out of about 38 countries, we actually don't rank very well in terms of how we're looking after children in this country. So that our child poverty level is around 17%, which puts us right in the middle of the pack. But we also know that within certain groups, prevalence of poverty is much higher, particularly among First Nations children on reserve, children in lone parent families, and so on. And in terms of nutrition, health, and survival, a quarter of Canadian children are living in food insecure homes. Our rankings in terms of overweight and under 5 mortality are also right near the bottom compared with countries that could be considered our peers. And UNICEF noted in one of their recent reports that child mortality is an important marker of extreme poverty and continuing social exclusion, particularly experienced by First Nations and Black populations. So there's a lot of work to do, and we know that your programs are at the forefront of this work, and this is something that we wanted to lend our support to through research. Something that UNICEF has also highlighted in their reports is that when it comes to government spending on children and families, Canada also ranks fairly low, and that these continued modest investments keep our country stuck in the middle in terms of making improvements in child well-being, where we could actually be a leader. And we know that constrained resources are a major challenge in the CPNP, and that's part of this larger picture of what's happening in our country.
Great. So, switching. Oh, yes. Is there a question?
Oh, yes. Sorry about that.
Yeah.
I just thought I would acknowledge there was a question about wondering if the results of number 2 be able to be shared with our projects. And I've been a little scattered answering questions about the board, so I don't quite have the context for it.
No worries.
But does that question make sense to you?
It does, yeah. So I can just flip back No, I cannot. Okay, yeah, so number two was our study looking at the provincial data as to whether there was a difference in the hospital formula supplementation. Yes, we'd be happy to share those findings. We do have the data in and we're just writing it up. So there's sort of that formal process where we need to officially publish it before we can distribute the results widely, but we'd be very happy to share with the network when we have that, and it will be in the near future.
Thank you. Thanks very much.
Yeah.
Great. Yeah. So shifting to the CPNP, I think we are a bit biased, but we do believe that the CPNP offers a great opportunity to invest in maternal and child health equity. There are, of course, direct benefits to those most vulnerable in our society within the CPNP, thinking about pregnant people, their families and infants. And it is a program that is very uniquely focused on the prenatal and newborn period. There are not that many programs federally that are actually focused on this period. There is the Canada Child Benefit, but not necessarily all who attend the CPNP are eligible for that. And it's unique in that it also already exists. It's a community embedded program. The way we kind of like to frame it is, imagine if there was a renewed investment in the CPNP, because as I'm sure all of you on this call know, the funding has been static since the 1990s. From Public Health Agency of Canada data from 2019, it suggested that there's 33% less purchasing power when you adjust for inflation. There's no 2025, so it's likely even less purchasing power at this time. But on the flip side, what the Public Health Agency of Canada has also seen is that for every dollar invested, there's actually a really large return by CPNP sites. The estimated amount in 2017 was 89 cents. Again, it's 2025, so it's probably even larger given that the funding package is not increased. So the concept of the CPNP survey itself was something that our group had been thinking about quite a bit. Alison talked about this already a bit, but something that we came to realize was that programming is very flexible, which makes sense. You want to adapt programming so that it meets the needs of the communities served, but there hadn't actually been documentation of the different activities that had been done. And our group has a keen interest in breastfeeding and food support, so we want to try and document these. We're interested in breastfeeding because it has such huge impacts for maternal health and child health, in both cases, and it's recognized by the WHO as being very important to improving health outcomes. And then also with food supports, there's a relationship between breastfeeding and food insecurity. So it ties together, as well as that food insecurity is also quite, it's increasing in Canada, of course, and quite a large amount of interest. With respect to the COVID-19 pandemic, of course, this had huge impacts for Canadians all across the country, especially in relationship to health services. Yet it was noted that CPNP sites continued to serve their communities despite these different stressors. So we wanted to understand, how did the pandemic actually affect breastfeeding and food supports within CPNP programming? Now, we thought we'd get into the process of actually launching a survey because it has been a several-year process. Research takes a lot of time. But just to start with the development of the protocol and the survey, this would have started 3 years ago in February 2022. Discussions had actually happened even earlier than that in the summer of 2021. And we are very grateful as we developed this protocol and the survey and got ethics approval for the feedback that was provided by those Toronto partners. They were actually able to put us in touch with the Ontario Public Health Agency of Canada regional lead, where we got to have a discussion about how do we actually send out this survey, which we've devised. How do you actually get it to those CPNP sites? Because we didn't have those details. At that point in time, the thought was that the survey would be based in Ontario and Atlantic Canada, given our colleague who works there. But it actually got bigger. So the Ontario regional lead was able to put us in touch with the national office, and we talked with them and got permission as well. And in that discussion, it actually became a national survey. That's where we got to have this reach all across Canada. We did exclude Quebec, admittedly, just because there's a different delivery system, but of course, it would be very interesting to include Quebec in the future. One of the things that had come out of those discussions was, how do we actually connect the CPNP sites? And the thought was to connect with different regional leads across the Canada through the Public Health Agency of Canada. And so we got to talk to them. And then from there, we also talked about engaging an advisory group. And we saw some of those who were on our advisory group were on this call. So thank you so much for your time. This was a self-nominated process, and there was feedback on the survey questions. Did they resonate with individuals, and was it reflective of what their programming actually offered. So as you can see, this is a long process. It took over a year in itself, and that wasn't even the launching of the survey. So there were 3 different phases to the survey launch itself. First was the pilot test, which was completed by the advisor group just to make sure that everything was functioning properly. It made sense. Then there was actually the national release. This would have been in May 2023. And again, that was through the Public Health Agency of Canada, regional leads helping us with that. And then there was this third phase that Alison just talked about, the qualitative study, which was Ontario only. But in developing the survey and in talking with the advisor group, we came to discover very quickly that while numbers are great, they don't give a lot of depth of information. So Alison will highlight this quite a bit as we go through the survey as well. So in terms of the actual flow, the survey was offered by an online platform in both French and English, the 2 national languages of Canada. As mentioned before, it was distributed by the Public Health Agency of Canada regional leads via email. And I think an important thing to remember is that the survey was actually completed from the perspective of what someone who were to attend a CPNP site would actually have access to. So it's not what do the funds actually allow one to do, but if someone were to come to your CPNP site, what do they have access to as a whole? There were 5 different parts. You can use the QR code to access the graphic report that was prepared as well as the full report. But we're going to take a pause. Don't worry, that QR code will come back and we'll share it again on the board as well. We're going to take a pause to talk about the qualitative study.
Yeah, so just some background of how this was done. And this study was funded by the Sick Kids, so the Hospital for Sick Children, Center for Global Child Health, Catalyst Grant Program. So we're very grateful for that support, which enabled us to add this component to deepen our understanding. So the way that we conducted this study was a series of one-day research events that happened in 5 regions of Ontario, and the specific locations were Kingston, Hamilton, Toronto, Timmins, and Thunder Bay. In all except one of those sites, a CPNP site offered to host the event, which was wonderful. And in the one where we weren't able to do that, it was just a matter of logistics, certainly not willingness. We had 3 to 7 sites participate per region, and the participants were identified through the national survey. So at the end of the survey, there was a question asking if you would be open to be contacted for further research. So those in Ontario who had checked yes, we reached out to. We also reached out through this network, and thanks to Sydney for circulating those advertisements. And there was a bit of word of mouth as well. So we do realize that there may be people who might have wanted to participate and didn't hear about it, but we want you to know we tried our best to reach as many as we could. And we also realized that even having those 5 locations, it's a very large province, and it's not possible for everyone to travel to one of those sites. So we apologize if you would have liked to participate and it wasn't possible logistically, but we appreciate everyone who was able to join. We had 28 participants in total, representing 26 CPNP sites. And the research day included 2 main activities. So one was a focus group discussion where as the group that came together, we talked about why specific types of breastfeeding food support activities were implemented at different sites, how that was done, how it had changed over time, kind of what does all that look like, and what were the success factors and barriers or challenges. I'll be sharing some findings from those focus group discussions during this presentation because they really do amplify what we learned from the numbers in the survey. We also had a second activity that we're not going to focus on today, but just to make you aware, we also did a priority setting exercise where the CPNP personnel participating in these events ranked a series of outcomes they would be interested in seeing monitored for the CPNP and a list of research priorities they'd be interested in the future if there were to be opportunity to strengthen evaluation of research. So we're not going to say further about that in this, but again, we're going to have a report coming out on this whole qualitative study, and we'll be happy to share that with this network as well.
Great. So there were 5 core components to the survey, and we just want to acknowledge that the survey was quite large. It was anticipated to take 30 minutes, but depending what supports were actually provided by an agency, it could definitely take upwards of an hour. So thank you so much for your time in completing it. We wanted to know a little bit about general site characteristics, just so that we could understand who was participating in the survey. This included location, whether those sites were within a multi-service agency, and different characteristics about participant engagement. We also were interested in general service provision, so just knowing what types of program were offered, when was it offered, and were there any caps to accessing CPNP programming. The depth of it was around breastfeeding and food supports. This was with a reference period of the last 5 years, so within 2018 to 2023 at the time of conduction of the survey. There were different categories, but also some open-ended questions for both of these. And then we also wanted to know, as mentioned before, a little bit more about the COVID-19 pandemic and how both participants and personnel were coping with the COVID-19 pandemic within the CPNP. I will also note that we asked questions before, during, and what we sort of call post-pandemic with respect to breastfeeding and food supports. This related to how did the services, how were they provided at different times, who could participate, and was there any funding? There was a lot of information in the survey, and we've taken sort of some key findings and core components out, but there's so much more detail, so do feel free to look at the full report if you want to see really the real details that are there. There's a lot. So in terms of responses to the survey, it did go out to 207 different sites. In total, we had 91 different sites that responded. So that's a 44% response rate, which we were really excited about. It's quite high for this sort of survey. And this did represent all of the different provinces and territories, which we were very thankful about as well. Another thing that was really great was that there were 21% of participants who are actually Indigenous-led agencies, so we were very grateful to have that representation as well within the survey. So thank you to all those on the call who completed the survey. We really did appreciate your time and are very grateful that you took the time to do this. So shifting then to general site characteristics, what we found was that about 25% of sites were rural, 75% urban, which is reflective of the general makeup of sites within the CPNP across the country. The majority were based within multi-service agencies. So this is just shown in our graph off to the right-hand side, the different agencies, or sorry, different additional services that might be provided by an agency, ranging from child development to food banks to mental health services and other elements. 75% of respondents did offer CAP C in addition to CPNP, which again aligns quite well with what we know from the Public Health Agency of Canada about CPNP sites. So it gave us confidence that the sample that we had was actually reflective of the national landscape. 73% of different CPNP sites delivered their programming with collaboration of partners. For the most part, this was public partners, but it could also include nonprofit and private partners as well. And in general, sites enrolled up to 110 prenatal participants per year. When we asked about general service provision, the predominant types of programming were group programming, one-on-one programming, and center-based, but of course there were lots of telephones, emails, and text messages being sent too. Most sites offered their programming weekly, and programming could be either during pregnancy or during postpartum. Some sites had both, some sites had one or the other. Something that we found quite interesting was that 25% of sites actually reported being at a maximum capacity. So this meant that they had to limit their programming. It could be based on number of visits, an infant's age, or a combination of the two. So it's not that they didn't want to enroll more participants, it's just that there were restrictions to what could be done with the resources that were available. So they were at their maximum. Shifting to the breastfeeding support findings. So every site that participated in the survey did report at least one type of breastfeeding support. They were more than one typically. And this really speaks to the core of breastfeeding supports within the CPNP program itself. There were 4 different categories. The first one was education about breastfeeding, which included education materials. So thinking about pamphlets, posters, books, or videos, or YouTube clips. These were provided by 95% of sites that responded to the survey. So the most common support with respect to breastfeeding. There were also live education sessions. This was reported by 69% of respondents. These were typically webinars or seminars, and they were usually led by CPNP personnel, but sometimes there was a public health nurse, a doula, or a midwife that could provide these as well. So that was education about breastfeeding. Another very common breastfeeding support was referral to community services. Typically, this was a public health program, but it could also be a hospital clinic, or it could be as well telehealth. And importantly, there was making the referral, but also helping participants navigate the complex landscape as you try and do this sort of thing, because it's not always easy. The third category was support to breastfeeds. This was actually engaging with someone to support breastfeeding itself. There were 3 different categories. This could include peer support that was supported by 51% of sites, engaging an international board certified lactation consultant reported by 34% of sites, or 77% of sites reported some other lactation support provider. So this could include a public health nurse most commonly. It could include a midwife, a doula, or a dietitian as well. So these were all individuals who really supported the active breastfeeding, and you can see that they had different levels of qualification. In the open-ended questions, something that came out as well was that there was really a stated interest in increasing access to skilled breastfeeding support providers, again, speaking to just the importance of breastfeeding within the CPNP program as a whole. The fourth category was providing materials to support breastfeeding. 68% of sites reported providing breast pumps to participants. Typically, this was something that was donated to a participant or loaned to them, and CPNP personnel would actually provide training as to how to use the pump. And then with respect to the other lactation services and supplies, which was reported by 34%, this could include different materials like a nipple ointment or breast pads, or some sort of breast pump accessory that was provided in addition to the other items. We did ask questions about funding, as I mentioned before, and I think across the board, it's really important to note that there's all these great different breastfeeding supports that are being offered, but funds beyond the CPNP core fundings were really required to offer these different supports, and that was for all of the different supports. But in particular, where you required additional resources, so thinking about access to an IBCLC or other lactation support provider or breast pump, these were largely funded by external resources alone. So overall, what we did see was that there were disparities between sites and what they could offer, especially when there were additional resources to require. This reflected potentially one's location, being rural or urban, and what was actually available in your community, as well as what your organization actually offered as a whole. I'm going to switch to Alison to provide a bit more context with respect to these numbers.
Yeah, so what we heard in the focus groups across Ontario really amplified kind of the meaning behind those numbers that Joanna shared. And something that came out very strongly is that across the different regions of the province, CPNP coordinators felt that there was so much more to breastfeeding support than education. And that was the one activity that everybody could offer, as we just saw, but there's so much more to it. And the CPNP is really uniquely positioned to provide that more, and sort of emerged into this model that's shown here, where for families with complex life stressors, just education alone often is insufficient. And so it all starts with trust and relationship, and building those connections that is so central to the CPNP and so important for these families, which then leads to the opportunity to help them with major life stressors that are obviously first priority. It strengthens social support, builds community and connections. And then within that environment, if there's the opportunity to offer personalized breastfeeding support, to kind of layering it on, that can be very effective. This, of course, all takes time and skilled personnel, and as we just saw, that's not available consistently across the CPNP. So some of the things that we heard, there's a couple of specific quotes from participants in the focus groups. So speaking to this issue of life stressors, and that there's a lot more going on that influences breastfeeding than just say knowledge and some tips and some support specifically for breastfeeding. So this coordinator said it's not often the initiation of breastfeeding, that's an issue. It's maintaining it or trying to figure out ways to combat the other determinants that impact your success with breastfeeding. Like, well, we haven't found a place to live. My toddler's hungry and I'm stressed. I don't sleep. I'm not eating. I'm not sleeping. So then you have all kinds of other issues you're trying to address to support their breastfeeding, successful breastfeeding stories. So that really situates breastfeeding within that larger context of people's lives and the supports that CPNP can provide to clients, and then how you kind of fit specific breastfeeding supports in within that. And here's another example Or this coordinator said, speaking for a client may come to talk about sore nipples, but what she really wants to talk about is her mental health and that she feels alone and isolated and doesn't think she can do this, right? I think it's asking the right open-ended questions and meeting her where she's at, and then developing that support plan for her. So again, speaking to the trust, the relationships, the life stressors, and being this phrase, meeting her where she's at, this came up a lot in the open-ended responses on the survey and in the focus groups. And it's really a core value, I think, and also a really important principle for how breastfeeding support is delivered in these kind of circumstances. And it really is so much more than education. But as we just saw, that takes additional resources.
Thanks, Alison. So shifting then to the food support findings, again, all sites provided food supports that were surveyed within the survey. The most common support that was provided was providing a grocery gift card, and this was reported by 87% of participants. Typically, this was purchased by sites and provided either weekly, bi-weekly, or monthly. There were a lot of different numbers and a lot of way that these were administered, but in general, from the calculations that were done, the median net amount per participant was $40 to $50. So that means about a $10 gift card a week for a month or for the length of participation. So it's not a huge amount. It is something that can be given, which is very helpful to those families, but it's not as though it's a large amount, but it's helping. So another item that was provided was food for households. And so this could either be groceries or a food hamper. That was reported by 73%, or as well, some sites, 19%, reported providing a meal kit delivered to the home. Now, more sites reported purchasing these items, so food and groceries and meal kits. That was 80%, but there was also a very large reliance on donation. For groceries and foods in particular, 40% of sites reported that they relied on donations and 20% for the meal kits, which speaks to just the supply aspect of it. When you rely on donations, you don't necessarily have a reliable supply. Another thing that was provided with respect to food supports was food during programs, so either snacks or meals. These were typically prepared by CPN personnel and were really felt to be important to building the community aspect of it, which Alison will talk to more. Multivitamins were also something that were provided by 73% of sites. These could either be purchased, that was 65% of sites reported that, or donated to sites, 45% of sites could reported that. You could report both of them as well, but just speaking to the complexity with having a supply when you do rely on a combination of purchasing and donations. And infant formula was reported to be provided by 48% of sites. The ability to provide formula was often based on supply, so what was actually available at the site. 50% of sites did report relying on donations, so typically this was from a food bank, and 30% relied on a combination of donations and purchasing. So that could complicate what supply you actually have available. As well, it's important to note that it wasn't always that formula was available to all participants. There was usually some sort of criteria about need for formula or meeting other criterias, and that's how it was provided. Again, with respect to funding, the same as the breastfeeding supports, funds beyond the CPNP core funds are required to offer food supports. And again, this was for all different food supports. And similarly, this led to disparities in what sites could actually offer. And sometimes there was actually a shift away from being able to provide food supports just with the increase of food costs and inflation. And there was a more reliance on donations for food supports relative to breastfeeding supports. And again, that reflects an inconsistent supply, which is really challenging. So Alison's going to give us some more details on this.
Yeah, so these same issues came up, not surprisingly, in the focus groups around Ontario. And what we found overall is that food supports are considered essential to the CPNP for a number of reasons. And we identified from the focus group discussions 4 main goals that combinations of which different sites were focusing on as they implemented food support activities. So there's a goal of client engagement, of contributing directly to food needs, building community, and improving food and nutrition literacy. And the different types of activities that are in the middle of this figure fit with one or more, cut across these different goals. And so what we found is that the process of determining which activities would be implemented at a specific site, related partly to which goals were a focus, but also very much, as Joanna just said, to what resources were available, including not just money, but also things like access to a kitchen facility for cooking classes and food demos and things like that, access to food bank or donated foods, and so on. So there are a lot of things going into the mix of how food supports work, but they are certainly considered important by all, and they were seen to contribute to both nutrition goals, which of course is core to the CPNP, but also to social goals around the engagement and community building. So here's one quote from a participant in Eastern Ontario who said, "When it comes to food, our programs are 100% the way we engage community. We bring them with food. We talk through food, we engage through food, and we don't just serve light meals because we recognize that for a lot of our community members, this will be their only meal of the day. So we make sure that we have the food available at all programs." And that's speaking at the agency level, but including the CPNP within that. So that touches on a number of those goals around engagement, and also meeting food needs, and also food as a vehicle for communication and program delivery itself. Another quote from a coordinator in Northern Ontario said, "Our food is not solving food insecurity. However, because we're giving them grocery gift cards, I feel like I can still give them some prenatal education around nutrition for themselves. Because if they're surviving off the food bank or not even, it's hard to have conversations about the importance of fruits and vegetables for their unborn baby when they're not able to afford them." And we heard this from a number of people, this concern that how can you deliver a nutrition program if you know that people aren't able to access nutritious foods? And so seeing the CPNP food supports as at least something of a bridge towards meeting that gap, even though there were obviously it wasn't solving food insecurity.
So shifting now to the effect of the COVID-19 pandemic on breastfeeding and food supports, I think across the board, there was a really big shift in programming delivery methods. And this is probably true in many areas of our life. So when we looked at group activities within the CPNP, this is the figure that's shown there. What you see, the bar in green is what was done pre-pandemic, and then you have two components. There's in-person service delivery, and then there's virtual service delivery. So you can see that before the pandemic, pretty much everybody was providing in-person service delivery with very little virtual. During the pandemic, then you see that orange bar, and there's this huge increase in virtual services as things are locked down and you need to limit contacts. Now, in the future, which is the yellow bar, there is a shift to maintaining some of that virtual service delivery as well. So it's been an interesting change. And we all know there's challenges with navigating to virtual platforms. It is not easy. Zoom, it's easier now, but it's taken a lot of getting used to. With respect to breastfeeding support, there was a substantial loss of public health personnel. And you heard, as I mentioned, those different breastfeeding supports, just how public health played a role in providing those. One thing that was remarkable was that CPNP personnel really did try to fill the gap where possible. This wasn't always possible, but staff were often taking on additional responsibilities in an already constrained working role where you have a lot of responsibilities, which really spoke to their resilience, but challenges as well. Another thing that was noted was the increase in food support needs. So we did have a question where we asked those who provided a food, so that's the groceries, the food hamper, or a food kit, if you worried about having enough food to give participants. We asked this pre-pandemic, during pandemic, and in the future. And pre-pandemic, already it was about 40% had worry. This increased to 60% during the pandemic and 75% in the future. So just this really big increase in worry about food supports. Food inflation, of course, has increased substantially, but also the needs of participants are very complex and have increased in complexity, which I'll talk about in a moment.
So when we looked at the open-ended responses on the survey, where people who responded to the survey were able to just freely write things they wanted to share about coping with the COVID-19 pandemic, again, what we saw is that there was this amazing flexibility, all these adaptations were made, and that the CPNPs really tried to fill service gaps wherever they could. So here's an example from the Prairies region where the coordinator says we were able to provide virtual groups every day of the week, which was wonderful. We had difficulty securing public health nurses as they were busy with COVID. The virtual groups made it difficult for those without internet or unstable housing to receive the same level of info they would have received prior to COVID. Staff worked hard to stay connected by phone, email, texting, and doorstop visits when it was safe to do so. So lots of adapting, lots of innovation, lots of creativity, really working hard, but some challenges within that as well. Here's another example, speaking to how CPNP sites not only tried to continue their own program as best they could, but also picked up some of the roles that may have been done by others in the community. So this coordinator says, I think one of the things during COVID, what happened was that a lot of our partner agencies really reduced their services, and some of them haven't returned still. This was a year ago. And so I think that our agency never stopped and sort of picked up the slack, because the families that we serve were so vulnerable and at risk, we did not feel that we could step away.
Great. So what about coping during the COVID-19 pandemic? I'm sure you can all attest to this, but participant needs have increased. That was something that we heard within the survey. This is in a multitude of ways. It has included, of course, social isolation with lockdowns. Pregnancy and postpartum was a very complex time. There was mental health needs. These were increasing during the pandemic. Food insecurity, of course, also increased, and housing insecurity too. So you have participants with more complex needs than prior to the pandemic. This, of course, was also paired with a decrease in community-based health services, just because there were lockdowns. There was a shift to different ways of providing services, particularly with virtual methods. And these two combined different pressures created a lot of stress. This included staff stress, burnout, and turnover, and these all increased due to a combination between these two different complexities.
So again, some of the open-ended responses on the survey speak to this. So at the same time as there was all this innovation and adapting happening, it did take a toll. It was a very hard time, and we want to acknowledge that. So one of the coordinators in the Atlantic region said that mental health issues, both for staff and participants, job insecurity, a lack of humanity for pregnant moms who were going to give birth during the worst COVID times. New parents were beside themselves and did not know where to turn when it came to their pregnancy, mental health, food, and job insecurity. Lots of really hard things going on. And from the Western region, one coordinator said COVID-19 was a big challenge for our program. We had staff that were creative and innovative to respond to the needs of our families, which was amazing, but the strain has taken a toll on our staff. We've had chronic staff shortages for a long time. This puts additional strain on the staff who are at work, and that leads to their burnout. It is a tiring season, and I would imagine that many of you in the audience can resonate with that.
So we just wanted to come back to our overall findings. So we did find that CPNP sites are implementing breastfeeding and food supports in very different ways, but they're also very important to programming. As well, there was a noted interest in increased access to skilled breastfeeding support providers. For food, rising costs have really increased participant needs, and there's limited food supports that CPNP sites can provide. For funding, CPNP sites rely heavily on in-kind services and external funding to deliver both lactation and food supports. You just heard that the COVID-19 pandemic really exacerbated chronic programming issues related to resources, staffing, and service delivery. But CPNP program was also very resilient during the COVID-19 pandemic, and sites adapted and continued with service delivery despite the many challenges and although it did create stress, that there was still a continued dedication to participants, which is something I think we've heard over and over, is just the amazing dedication to supporting those engaged in the program.
So we want to let you know how we've been sharing these findings and how we plan to. We're particularly excited to be able to share that 2 weeks ago, we had a meeting with the Honorable Yara Sachs, who's the Federal Minister of Mental Health and Addictions and Associate Minister of Health. And that's the screenshot from that meeting. And we were able to share these findings, a shorter presentation of the highlights of these findings, and to talk with her about the importance of CPNP and the constraints that the program is under. And we're very hopeful that that will lead to some changes. So we wanted to share that with you. We've also had an article about the survey findings put out by University of Toronto Media. You can access that through that QR code, if you're interested. And we have further plans to communicate with a policy brief, and we want to leverage the opportunity we had to connect with the minister to further distribute the findings from our work. And we will also be preparing a report specifically on the qualitative study that we'll be happy to share with this network as well. And we mentioned our other studies too. We'll be happy to share findings from those.
So with that, we would like to acknowledge the large group that has been involved in this. We have collaborators at the University of Toronto and Acadia University, our community partners in Toronto at Parkdale Queen West Community Health Centre, at the Public Health Agency of Canada, in particular, Blanca Serrano, who has helped to push things along a bit. And of course, all of those who participated in the advisory group and study participants too. And we do appreciate our funding as well to be able to conduct this work. We are completely independent of the Public Health Agency of Canada, so this is be completed with additional funds from other places. And with that, thank you so much. We've got the QR code for that full report. If you do have any questions, we'd be very happy to answer them now or hear your thoughts on the survey findings.
And please do feel free to use these findings. We know it's a renewal process currently. We know you have other reports and evaluations and things that you are part of. If this work is helpful to you at all, please feel free to use it. And you can get the full report with lots and lots of numbers and details and some regional breakdowns as well at this QR code.
Oh, thank you, Alison and Joanna. I'm going to maybe remove the spotlight, welcome other people onto camera. And certainly there was a question. I do have a question from the chat. Lee asked about when you were talking about virtual service, does virtual service mean platforms, or did it include other methods like phone and text that you're aware of?
Yeah, so this meant platforms in this context. We did also hear a lot that there was phones, text messages, emails as well. In this context, it meant delivering your programming, so perhaps a webinar or something like that, using something like Zoom or Teams or Google Meet, a virtual platform of that variety.
Excellent. And actually some other questions have popped up here. There was a request for sharing the link to the report outside of the QR code. Is that maybe available to put in the chat?
I can close my screen and do it at the same time.
I can put it onto the Miro board as well.
We'll do both.
Sure. Yeah. Oh, that would be great. And when you get a moment, it doesn't have to be right this second. Clarification, you stated that the median net amount was 40 to 50 per person. Was this for the duration of their participation, or weekly or monthly?
That was for the duration of participation. It could also change. So it's probably not representative of all sites. Depending on the resources that were available, it could change, but that was for the duration of participation.
Okay. And there is a comment here from Ellen. Do you want to speak to that, Ellen, or would you like me to read it?
Sure, I can speak to it. I just was a bit surprised you found the food support so integral in pulling families in and supporting families in CPNP, and yet in our new the title of our new application doesn't even have the word nutrition in it anymore. And nor does it really ask for any type of nutrition activities in our work plan that we're to be filling out. So it's almost like nutrition has been sort of, taken out subtly, perhaps. And I know that we can work nutrition into the work plan. I know that, and I know we all will, but it's not as prominent as it was in the past.
That's interesting to hear. Yeah, it definitely came out strongly, and in particular that connection to supporting families with nutrition when they can't access food, like it just doesn't make sense, right? These go together. So while CPNP is not improving food security is not the main outcome, but just recognizing this is the circumstances of people's lives, as well as food has it has many meanings, right? It's not just about nutrition. So that whole bringing people together, creating those social connections, food is so is so powerful for that. It's so important. And so we were hearing all these things and seeing this kind of multiple roles that food supports played. So while nobody was claiming that food supports were fixing food insecurity for families, there's just lots of importance. So that's interesting to hear. And I'm sure others in the audience would have more to say about how you're kind of approaching that or thinking about it, but that's what we certainly saw in our work. So if that helps you in trying to present your plans or to advocate for that, please feel free to use our findings.
You know, if you were somebody external that picked up this application package, you might not even, we know that nutrition is a big part of it, but if you picked up this application package, you might not realize or recognize that was or should be a component of your program.
That's a big change.
So, yeah, I do worry about that a little bit because we as dietitians know, I mean, every event food is centered to it. If somebody invites me to something and they don't provide any food, I'm probably not going back the next time, let's face it. But and I'm not in a food insecure situation. We've also been told that we shouldn't be acting as a food security type of agency. And even there's been discussion I know that we've had with some public health agency staff who have said we really shouldn't even be putting any funding in for the food vouchers. That's sort of something that we shouldn't mention like overtly, but we know it is important. It's $10. It's not a lot, but it brings them in the door. It really does.
Yeah. Well, we certainly heard and saw that. So again, if it helps to cite these results, and I can say that when we met with the minister, she particularly commented on the rising rates of food insecurity and how important food security is for perinatal mental health. So that was something that I think particularly struck her in our discussion. So I don't know where that will lead, but I hope that's somewhat encouraging as you're trying to navigate how to go forward on all that.
Well, your presentation was very timely, so I appreciate it. Thank you.
Yeah. Hi, Yvette.
Yvette, hi.
Nice to see you.
Hi, yeah, great job. Amazing. Thank you so much. And it's also timely for us to use as supporting documentation for our proposals as well. I think, and I agree with Ellen, I think it's all about how we present and utilize the wording around food and providing the voucher. And I think, utilizing food as a teaching moment in getting optimal health, utilizing it in building relationships and building connections, and kind of like opening that door. And I think that the adverse focus is that there has been some federal conversations around food insecurity in developing, for example, breakfast clubs across, and securing food banks across. So I think that there's some of that conversations of not putting food security as the center of CAPC, of CPNP programming, but kind of focusing on the other determinants of health. So I don't think I think that's, Ellen, you're exactly right, is getting the voucher, even though it's small, or for us, we give perishable food items. That's what keeps them coming, right? And that's what keeps them feeling sort of connected. It's the bonus that and go away with all these amazing groceries and recipes for us. And then same thing with the breastfeeding support. I think one of the quotes, probably us, in our program, where they're talking about, meeting our participants where they're at. And a lot of times, the questions that they kind of come in, like I might have sore nipples, it really isn't the answers that they're kind of looking for. They're looking for feeling exhausted, isolated, lack of self-confidence, right? And just having that sounding board of somebody to be able to say, we're here for you. And that is, I think, nice to hear how important sort of that CPNP program is in providing and building those types of relationships. So it's nice to be recognized, and then that the research actually supports the things that we think we're doing in a silo. So thank you so much for that information.
Yeah, our pleasure. We hope it helps also to know that there's lots of the programs across the board are facing the same challenge. Like, we don't want those challenges to be there, but maybe it's also somewhat encouraging to know that you're not alone.
I think you were a part of the advisory group, Yvette, and you probably heard that as everybody across the country was there talking about similar things and really identifying with one another.
Yeah, I think that actually makes you feel supported, right? That you're not alone and it's not just you. And are we doing something wrong and what's going on? I think post-COVID, it's kind of like everybody's kind of like, well, we're not back to normal, and everyone kind of says the new normal, and it just nothing seems to sort of even be settling. And I think when you talked about, you know, trying to find your community partners and all the things that and the supports where they were, and looking at sort of staff turnover and the exhaustion, right, and the multiple needs of our clients that haven't gone away, right? So I think that the needs during the pandemic continue to sustain. And I think that that's something like that a lot of times policymakers and even some of our funders are kind of like, whoa, you know, it's all over. Pandemic is over, right? So as I just recovered from COVID, yeah, it's not over.
Are there any other, we maybe have time for another question, if anybody has, or comment? There's been gratitude in the chat, Joanna and Alison, for the session. Very informative. Thank you so much. And I see the links have been put on the Miro board. That's great. But yes, any last questions or comments for our presenters before we move on? Okay. Thank you so much.
Thank you
Alison
for the
and Joanna.
opportunity to share.
It was really great to have you here. And yeah, I'm seeing more comments come on about such important research, and especially during this time of transition that we are in, and you know, helping us with just having that information to, you know, kind of raise the awareness that we need to raise. So, so that brings this session to an end. I'm going to stop recording right now.